Most of us have had blood tests done before, a common procedure used to confirm many medical conditions, including cancer. Today, we have Kim Collison, Laboratory Director at Spectrum Health, and Stephanie Williams of the Adult Blood and Marrow Transplant Program, here to talk about advanced technology labs. And they're using this to better care for patients. Thank you to both of you for joining us here on 8 West.
Well, thank you for having us.
Yeah, Dr. Williams, I want to start with you because we are so lucky to have Spectrum here in our community, the professionalism. There's so much that we are grateful for. But you also have advanced technology and you go above and beyond in so many ways, including laboratories. So why don't you tell us a little bit about how that can help with patient care?
So it's actually extremely important, particularly for patients with certain cancers that involve the bone marrow, like leukemia, lymphomas, and another cancer called myeloma. It helps us to diagnose the patients faster and more accurately, to follow the progress of their disease during the treatments that we give, and even at times to guide us in what is the best treatment for a patient with those types of cancers. Kim can elaborate more on also what that means from her standpoint as the laboratory director.
Yeah, when a patient is diagnosed with cancer, they obviously have a million questions. Their mind is concerned, obviously, about their care and their health. You have something that's called the Advanced Technology Laboratories. So why don't you elaborate and tell us exactly what that means?
Well, the Advanced Technologies is really a unique set of laboratories that you don't usually find in a hospital setting. There is flow cytometry, cytogenetics, and molecular diagnostics. These three laboratories combine all of their technology to really aid in the treatment and the diagnosis of cancers. And one of the things is how fast we can turn around test results. It really makes a huge impact on patient care.
Yeah, that's so important. People want results. They want to know the answers to these tests as soon as possible. What is the difference between the three of these?
The easiest way is to kind of describe the parts of the cell that they look at, because they really build on each other. Flow cytometry is the study of the proteins on the surface of the cell. So we're first looking at the outside of the cell, and that's where we diagnose leukemias and lymphomas. In cytogenetics, we go inside the cell and we pull out the chromosomes, and we're looking at a variety of methods to determine if there's anything wrong with the chromosomes. Then in molecular, we go into the chromosome and we pull out the DNA and RNA and do our testing on that.
Okay, it's a lot of information. I'm sure patients are so glad that you are the professionals here in our area. So Dr. Williams, this is a great laboratory feature. So why don't you tell us why it's so beneficial for patients and for professionals to have this here?
And we get coverage from this laboratory day and night, every day of the week, which is also very unique for this situation. So it allows us to diagnose a patient much faster. For instance, last Christmas Eve, we had a patient come in with a very high white blood cell count, very concerning for acute leukemia. Within 2 hours, we had the answer. We did not have to send that specimen out to another laboratory in another state. It helps guide us then in terms of the treatment, so we can start that patient's therapy much faster. In addition, with the new types of precision medicine that we hear about, the guided therapies, the personalized medicine, things like the flow cytometry, cytogenetics, and the molecular oncology allow us to more precisely determine the best type of treatment for that patient's cancer. So it helps the patients, it helps us as clinicians to get the answers to patients faster and to begin their treatment a lot faster.
Yeah, so with patients who are being diagnosed with cancer or think that they have a family history and may need to get checked, who is benefiting the most from the advanced laboratory?
Well, the patients with cancer, and Kim can correct me on this because I take care of patients with cancer, I think are benefiting the most in terms of other types of procedures to see if they have a family history. There are other tests that are done at Spectrum to help them along with that and to look at the genetics in their families. Kim, I don't know if you have any.
We do a lot of tests for other reasons other than cancer, a lot of prenatal testing, a lot of hereditary disease testing, but probably what we're most proud of is the testing we do to support cancer diagnosis and how quickly we can make the diagnosis.
Yeah, and if we have someone out there who has been diagnosed with cancer and they would like to have a second opinion, how can they get a hold of you?
So we have an 855 number that you see there on your screen, and they will be put in contact with a person and a navigator that will help them in terms of arranging a second opinion.
Thank you both so much for coming in. We really appreciate it.
Thank you.
All right, don't go away. We'll be back after this short break.
Are you West